Let me talk to you about some of the facts that we're dealing with today. Facts are our friend, right? People want to make decisions. They want to know the facts without spin, without opinion. And that's what we've been giving them. Total hospitalization rate is down a tick, which is good news. The change in hospitalization on a rolling total, you see, is down. Number of intubations is also down. The number of COVID hospitalizations per day, these are new people who are newly diagnosed with COVID. It's under 1,000, which is good news. It's still a significant number of people, 900 people. After all of this, we still have 900 new infections yesterday on a 3-day rolling average. But overall, you see the numbers coming down, so that's good news. This is the worst news. Every day, I think maybe today is the day the nightmare will be over, but it's not. 335 people passed away yesterday from this virus in this state. That's 335 families. You see this number is basically reducing, but not at a tremendous rate. And the only thing tremendous is the number of New Yorkers who still pass away. Everyone is talking about reopening. I get it. You can't sustain being closed. The economy can't sustain it. Individual families can't sustain it. We can't sustain it on a personal level. Our children can't sustain it. But we have to, when we talk about reopening, this should not be a political discussion. It shouldn't be a philosophical discussion. It shouldn't be because people are protesting or some people want it, some people don't want it. It is a factual discussion on reopening, right? So let's demystify it a little bit, because in this environment it's becoming rhetorical rather than factual. We want to reopen, but we want to do it without infecting more people or overwhelming the hospital system. We're at Upstate Medical today. Our great fear was the number of people infected would overwhelm the hospital capacity. So that's the balance. Reopen, but don't increase the number of infected people and don't overwhelm the hospital system. Well, then design that system in reopening, right? You can factually, with data, design a system that does just that. And that's what government is supposed to do. Government is not about spouting political or philosophical opinions. Government is about running services, designing programs that actually work for the people to address the problem. And in this situation, we can actually measure. We have data. We have facts. So measure what is happening in society and calibrate your reopening to those measurements, right? So we're adopting a set of rules, a set of guidelines. We've studied reopening plans all around the country. We've spoken to every expert on the globe who's been through this before, and we've come up with factual data points to guide us on reopening. First point, don't overwhelm the hospital system. If the hospital system in an area exceeds 70% capacity, which means you're 30%, you only have 30% left, or the rate of transmission of the virus hits 1.1, those are danger signs. We know that. Remember, hospital capacity, if you're at 70% on your hospitals, there's a 2-week lag on this virus. So if you ever hit 70%, you can expect the number to go up for the next 2 weeks as people who just got infected actually get ill, and some of them come into the hospitals. So 70% is a safe metric to use for your hospital capacity. If the transmission rate hits 1.1, that's what they call outbreak. That means it's going to spread much, much faster. You wouldn't start reopening unless you had a transmission rate below 1.1, really below 1. But if it hits 1.1, that means you're in trouble. So those are the two main data points. If you look at the state, and this state is different than most states. This state has New York City, one of the most dense urban areas on the globe, and then we have upstate New York. And if you look at our infection rate upstate New York, it's very different than the rate downstate New York. And if you look at the rate upstate New York, it's comparable to many states in the Midwest and the West. We hear the discussion every day, well, some states are reopening because they don't have that bad a problem. Some of the places in upstate have a problem that's comparable to states in the Midwest or the West. Much, much different than New York City. Okay, then let's come up with data points, factual points of what we have to do to reopen so everyone has the same opening template that we're dealing with. And we have to be smart about this. Again, I know it's emotion, and I know people are feeling emotional, but emotions can't drive a reopening process, right? We're talking about infection rates, we're talking about hospital capacity. Separate the emotion from the logic, and we have to act as our logical selves here. And that's what smart means. Be smart about it. Don't be emotional, don't be political, don't get pushed politically into a situation. Protesters are in front of the Capitol, we better reopen. No, I'm not going to do that. That's not how we make decisions. The first point is CDC set guidelines as to reopening for states. We think those CDC guidelines make sense, which is you have to have a 14-day decline in the number of hospitalizations before you go forward. Second, identify industries that you can start reopening that will bring people back to work, get the economy going, but you know you can do the appropriate precautions and social distancing. So in phase one, we're talking about the construction and manufacturing industry, right? Those are two industries that employ a lot of people, but we believe you can put the right precautions in place and learn the lessons from where we have been. And say to those businesses, this is not just about government, say to the businesses, tell us how you are going to incorporate the lessons that we just learned. How do you incorporate social distancing? How do you incorporate fewer people in a space so you reduce density? How do you have the right PPE? How are you going to monitor? Are you going to take temperatures of everyone who walks in? That's for businesses to decide also. Separate point, make sure you don't have what we call attractive nuisances, not really the right use of the term. Attractive nuisance is a legal term, but an attractive nuisance in this context, you open up a facility or an attraction that could bring people from outside the region to you. You have all this pent-up demand in the whole tri-state region. Make sure you don't open up something that's going to bring hundreds of people from the outside in. What business precautions will those individual businesses take? Watch the healthcare capacity. Your healthcare system cannot go over 70% capacity. Again, there's a 2-week lag. If you're at 70%, bells should go off. Don't go over 70% in your ICU beds. Many of the people who come in with COVID need an ICU bed because it's a respiratory illness. As a matter of fact, almost at the heat of this, almost every bed in a hospital turned into an ICU bed. That's why we needed the ventilators, because these people who get seriously ill with COVID need that level of care. Remember, you have a flu season coming up in the fall, and the number of hospitalizations normally goes up in the flu season. So anticipate that. Stockpile the equipment. we learned a lot of painful lessons here. One is you have to have the PPE, you have to have the masks, you have to have the gown. There's an international demand on it. So make sure we have a stockpile of reserve of the PPE. We have to have testing. How many tests? Dr. Birx recommends 30 per 1,000 people. Different people have different numerical percentages, but I think we start with that. Do we have enough testing sites? How long does it take to turn around a test? And then are we advertising to people, this is where you go and this is what you do to get a test if you think you may be infected? The whole thing with keeping that infection rate down is find a person early who is infected, let them know it, and then trace and then isolate. Do we have a tracing system in place? Mayor Bloomberg is helping us organize this. It's never been done before. Nobody ever heard of tracing to this extent. But tracing is, once a person says they're positive, you trace their contacts back, you notify people, you test people. That's a whole different operation. The current recommendation is you need at least 30 tracers per 100,000 people. So we have to have that in place. You have to have isolation facilities in place. Isolation facilities are when someone gets sick, you know they're positive, and they don't want to go home to quarantine, because if they go home, they could infect their family, which is what's happening now, a lot of these new cases. So we have to have a facility where somebody who is positive can quarantine for the 2 weeks without going home, and we have to identify them now. We have to coordinate regionally, the schools, transportation network, testing, tracing. This all has to be coordinated on a multi-county effort. We have to reimagine telemedicine, reimagine teleeducation. We have to have a regional control room that is monitoring all these indicators and gives us the danger sign if we get over 70% capacity, if the infection rate pops up. We have to have one central source that's monitoring all these dials that hits the danger button so you could actually slow down the reopening. And then we have to protect and respect essential workers, which I'll talk about in a moment.